Hello dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. Today we are talking about Succinate again. We talked about what is that, how it helps our body, how can it be used in medicine, especially in vascular problems, in heart problems, how it protects our body from stress, from low oxygen. And today we are talking about inflammation and GI tract problems, liver problems, and the use of Succinate. In some cases it may be beneficial, in some cases it may be hazardous. So let's figure out what is what. There are many studies that show that Succinate may actually increase the activity of immune cells and increase inflammation. That is good if it's short-term for protection, but it's not very good if it's long-term and chronic. The other studies showed that Succinate may actually be anti-inflammatory, and it is important for our gut microbiota and gut health. In addition to Succinate production by our cells, it can be produced by gut bacteria, which will process their dietary fiber. There are two types of bacteria in relation to Succinate. Some will produce Succinate from fiber, the other will consume Succinate and turn it into short-chain fatty acids. I always talk about short-chain fatty acids as they help us to support the health of gut, the immunity of gut, the barrier. Also, it regulates the health of body, of many organs, the function, their heart rate, their blood pressure, function of kidneys, pancreas, even mood, function of our brain. It can help to protect liver. That means they are very important. Any disbalance in microbiota can cause overproduction of Succinate and low consumption of Succinate, and vice versa, low production of Succinate, for example. Too much Succinate may be bad because it may cause extra inflammation, especially in colon. It may cause polyps and even cancer. And even some studies showed that lowering Succinate may help to alleviate inflammation. For example, in colitis or in inflammatory bowel disease, in Crohn's disease or ulcerative colitis. This is the scheme how Succinate causes inflammation, fibrosis by the way, and different diseases like rheumatoid arthritis, sepsis, liver fibrosis and cirrhosis, diabetes. So it's pro-inflammatory and pro-fibrotic. There is a huge difference between small intestine and colon, because small intestine has special cells to recycle this extra Succinate. They will use it for energy production and for immunity, to produce immune cells and to maintain a normal barrier. But high levels in the colon are totally not good because they can cause inflammation and fibrosis, because colon doesn't have this special type of cells. These are called tuft cells. We know that the levels of Succinate in feces and blood of patients with Crohn's disease or ulcerative colitis will be high. And many authors consider that the Succinate is the main mechanism by which the inflammation and fibrosis occurs. But to be honest, it may be the just core finding, because in these conditions there is a lot of inflammation, a lot of stress for body, and Succinate is released by body as the signal of stress, and the body tries to compensate by releasing Succinate. One must be very careful with conclusions. Article shows that there are Succinate receptors that maintain inflammation and fibrosis in intestine. The other shows that Succinate in healthy mice may help to protect the guts from extra inflammation caused by high fat diet and to maintain the normal barrier, normal immunity. But if, for example, there is disbalance, then this Succinate will be too much, it cannot be consumed and the problems may occur, especially if it all goes to the colon afterwards. Here you can see the mechanism by which Succinate may cause increased liver fibrosis or liver cirrhosis. But if you are sleeping there, then I want to impress you and wake you up a little bit. These are several clinical trials of our local Russian medicine. These trials are quite big. These are on patients as opposed to what I was talking about before. And they show us that patients with chronic viral hepatitis that eventually usually leads to cirrhosis, if you give them succinate, it may actually decrease the destruction of liver cells. It may help to get rid of viruses if you use it together with antiviral therapy, even in those patients who are totally resistant to this antiviral therapy. In 25 approximately % of cases, the adding of succinate may help to eventually get rid of the virus. And actually it helped a little bit the liver to restore its function and, for example, to increase platelets in those patients. Next, very important, inflammation. Many of you may have used interferon gamma as an antiviral remedy. The interesting thing is that this interferon gamma, also bacterial toxins, increase succinate. And this increased succinate will activate special type of immune cells, macrophages. There are two types of macrophages, M1 and M2. M1 are angry, attacking, protective, pro-inflammatory, attack, kill everything, protect ourselves, but too much of them will cause inflammation, injury, damage, and many other problems. M2 macrophages are tolerant. Calm down, don't attack anything, everything is fine. So here, when you use interferon, for example, M1 will increase. It will attack virally affected cells, cause inflammation, attack, for example, tumors, but can cause some, for example, autoimmune disorders, or it can cause inflammation in the joints or in the guts. And in the fluid in the joints of rheumatoid arthritis patients, or we, for example, can observe high levels of succinate and high activity of M1 macrophages. That means it's a bad guy here. Also in obesity, inflammation in these obese fat cells will cause a release of succinate, high levels of succinate, and connected to that insulin resistance, diabetes, high blood sugar, etc. So again, in diabetes and obesity, it's a bad guy. Here you can see what I told you before about synovial fluid, joint fluid in rheumatoid arthritis. Here you can see the article about obesity, inflammation, and macrophages. And in mice, if you block succinate receptors, then it will have some anti-obesity effect, it will have some anti-inflammatory effect, it will decrease insulin resistance and blood sugar. But in healthy, lean adults, succinate helps to control the inflammation in fat tissue. What? That means succinate is a good guy in healthy people, but bad guy in unhealthy people. Okay, but at least you know that okay, succinate is pro-inflammatory, it causes inflammation. It causes the activation of M1 macrophages. I will impress you now. Look at this article. Succinate may be anti-inflammatory. It may increase M2 macrophages that are anti-inflammatory, that will decrease the immunity. And by the way, tumors, they produce a lot of succinate that will activate these M2 macrophages that are for tolerance against inflammation and turn off all the immunity against the tumor. What? It means it's anti-immunity, anti-inflammatory. Just now we saw a lot of studies that shows it's pro-inflammatory and causes inflammation, immunity increase. That's weird. Too much succinate is seen in CNS fluid in multiple sclerosis. If we transplant neural stem cells to these animals, it will decrease the levels of succinate and it will decrease inflammation and reverse the findings of multiple sclerosis and attack to its own neural system. Okay, it's a bad guy again. Now I will show you some of Russian studies on patients. Studies on patients are more important, much more important than studies on cells of animals. In patients with stroke, use of succinate helps to decrease the size of stroke, the extent of neural tissue death, and it improves the recovery after stroke. Other study, 200 of patients with ischemic stroke due to thrombosis, showed much faster recovery of all the functions in these patients and less mortality. Okay, so now it's a good guy again. Diabetes mellitus in elderly people with neuropathy. They have a weakness, they may have some tingling, numbness of their fingers. The use of succinate helped them with their blood sugar, with insulin resistance, with all the signs of neural system involvement. And by the way, it helped with their depression or anxiety. And there are few more prospective placebo-controlled studies from our country that showed that succinate in diabetic patients helped with neurological signs, neurological complications of diabetes, and plus with their blood vessels, when the blood vessels are clogged by atherosclerotic plaques. For example, patients with obliterative atherosclerosis of their lower extremities, when they cannot walk because not enough blood is coming to their muscles of their legs, and they have a lot of pain, and they have to stop all the time because of this pain in their legs. And it really helped those patients who have these problems, atherosclerosis of arteries. And the biggest effect was in the smokers. 130% improvement in the distance they can walk, just using their 10 days of infusions, intravenous infusions of Remburin, the drug containing succinate. Here in our medicine officially it's used in very severe infections, in sepsis, in pneumonias, in multi-organ failure, in obstetrics, in premature babies, babies after difficult and problematic labor who suffer from low oxygen. And by the way, there were improvements in cirrhosis. One more article, succinate may actually decrease the calcium stone formation in kidneys, but it needs further investigations. Dear friends, that's all for today. In last video we talked about succinate, what is that, what's these functions, how it helps our body in normal conditions, how it helps in heart and vessel problems. In the next video we will talk about cancer, tumors, and can succinate be used in those patients, or does it actually increase or accelerate metastasis and tumor growth? I would appreciate if you write some comment below, maybe share your thoughts or your experience, or just wish something good to the others. And you can always support the channel if you wish by the link down below this video. My name is Dr. Igor Atabekov. Wish you good day, God bless you, goodbye. Don't be afraid,